Hi everyone. Welcome to today's podcast. We are diving into a really fascinating and important topic, genetic testing, a field that's transforming the way we understand healthcare, diseases, and personalized medicine. Before we begin, a quick note about something very close to us, Mission Brain, an NGO that works relentlessly to make brain surgery accessible to people everywhere, regardless of their background, situation, or circumstances. We are proud to highlight their incredible work in prompting equitable healthcare to everyone. To help us explore this subject, we have Dr. Garima Goel with us. Thank you, ma'am, for being with us today and share us insights about this topic.
Thank you, Shrikari, for having me here.
Okay, so let's start by, ma'am, could you please introduce yourself and tell us about what brought you into pathology, what brought you into genetic testing per se?
Okay, so if I start from the beginning, I was always interested in medicine. I always wanted to be a doctor. And during my journey of medicine, pathology came my way. And that's how I started my journey in pathology. And when I was going through pathology, genetics is a major component nowadays for the pathological basis of all the disorders. So yes, my interest in genetics stemmed from there. And I was very interested in hemoglobinopathies per se. So I'm working on hemoglobinopathies also. And from there, I got interested into genetic testing and further explored that area.
Ma'am, for our listeners who don't know what genetic testing is, who are from a non-medical background, could you just brief them about what, in simple terms, what genetic testing is?
So, genetic testing, as the word implies, is testing of your genes. Genes are there in the DNA. So, any modification or any change in the genetic pattern or the pattern of the DNA can lead to multiple disorders, starting from the inherited conditions going till oncology. So, all the diseases nowadays are associated with a genetic predisposition or they have a genetic basis for those diseases. Genetic testing in general, when we talk about genetic testing, it can be either prenatal genetic testing, antenatal screening, newborn screening, genetic testing for various disorders like cardiovascular disorders, neurological conditions. And nowadays, we all know that cancer has a big genetic. Yes, the cancer is has a big genetic basis, and that is being targeted for various therapies. So yes, so genetic testing has a very wide range.
Ma'am, so what are all the most common, like I would say, functions or most common roles played by like genes? What are the main factors they regulate? Like, yeah, from
Everything. Everything. Genes regulate everything. What proteins are formed, how your body functions. Everything has a genetic basis. So, what are those genetic alterations which can lead to a disease per se? Is what we are trying to find. So, the Human Genome Project, as you know, has mapped all the genes. So, what are the various modifications which can lead to any pathogenicity or any pathological disorder is what we are trying to find by genetic testing. Also, genetic testing is being advised so that less, like, if we can screen people much before for those genetic alterations, so we can one prevent the disease, or if the disease has already occurred, maybe lead to an early treatment and appropriate treatment of the particular disorder.
ma'am, and also like the couples who are planning for having a baby or getting conceived, how would you suggest them to when should they get a genetic testing done or when should they just start?
Yeah, so as you correctly mentioned, before they are planning, so if they have a family history, or if, even in the extended families, sometimes we say, oh, that is in my uncle's family, that is in my aunt's family, so it is not going to affect me. But even if in the extended families, if there is a genetic disorder, there is a history of any genetic disorder, so they should get themselves tested before they plan to have a baby or before they plan to conceive. So that is a pre, what do you say, pre-conceiving period. So that is where they should start the testing from. But in case if they do not do that, then maybe in the antenatal, during the antenatal checkups, the females usually are screened for hemoglobinopathies. That is one of the commonest genetic disorder for which the antenatal females are being tested. Other than the infections, that is one of the genetic disorders for which the antenatal females are being screened. Then they can also, if somebody does not come during those period, then at least the newborn can be checked. Another scenario where people go for genetic testing is if there are recurrent miscarriages. If they lose a baby, then both the husband and wife are usually checked for any genetic disorder.
Ma'am, in the antenatal period, which is around 9 months, when is it suggested to get a antenatal screening done?
So between 12 to 20 weeks, because we have to take a chorionic villus sample and amniotic fluid. So that is the period where they should go for genetic testing or a prenatal diagnosis.
In case of any problem in the antenatal screening, is it usually suggested an abortion, or is it suggested that they continue the pregnancy?
See, if we usually when we talk about antenatal screening, if I talk, there are multiple things which are checked. So one of them is they do a triple test to look for any aneuploidies like Down syndrome, Patau syndrome. So all those trisomies are checked. Then they check for other they do not check exactly for point mutations, but the ultrasonography is done for any developmental defect or any structural defects. So any chromosomal anomalies, they check through the ultrasound. It is called as an anomaly scan. And then we check for the hemoglobinopathies through blood. So these are few of the things which an antenatal female is screened for, so that the disease is not transmitted to the child. See, once we found out that she's at a risk of giving birth to, a high risk of giving birth to a child with Downs, then amniotic fluid is taken and a karyotyping is done. Okay, or chorionic villus biopsy is sampling is done, and then you do a karyotyping or a cytogenetic analysis. So in that karyotyping, if it comes positive, you do not recommend, you just give a choice. You tell the couple that this is how this is the risk, this is how this child will be once the child is born, these are the complications, these are the symptoms which the child has to go through. So it is up to them to decide. You can just tell them these are your choices. Your choices are that either you can terminate the pregnancy, or the other choice is that you can keep the pregnancy. But if this child is born with this disorder, so you have to present the facts. And it is up to the couple to decide whether they want to keep the pregnancy going or they want to terminate the pregnancy.
And what is the affordability and availability of genetic testing in India currently?
Availability, yes, there are few. It is not available at all the centers. If we talk about the primary health centers or the secondary health centers, so it is not even in the private setup. It is not available at all the centers. But yes, it is. People are becoming aware. People are increasingly going for these tests routinely, like for these screening tests routinely. Anomaly scan is something which everybody who comes to hospital during the antenatal period goes through. Hemoglobinopathy screening is something which anybody who visits the hospital. So I would say anybody who visits the hospital regularly during the antenatal period is getting benefited with all these screenings. But a major chunk which is still in the remote rural areas, who do not come during their antenatal period for a hospital visit, who are still giving birth to the child at home. They are the ones where we have to extend our reach.
Ma'am, is there a fixed period, like if a patient has a genetic disorder, let's say, he'll present only before 1 year or only before 2 years, or he can present at any point?
See, if we are talking about genetics as a broad spectrum, so inherited genetic disorders, yes. If they have a homozygous disease, they will present very early in life, right? Maybe within the first 2 years of life, or certain conditions within the first 5 years of life. But if it is a genetic predisposition or a genetic mutation which occurs later on in life, like if we talk about cancer patients, if we talk about cardiovascular diseases, so there can be a genetic predisposition, but they will come later on in life. But yes, for the genetic disorders which are inherited, usually the patients come early in life. And that too, it depends upon whether they are carriers, whether it is a mild form of the disease. So there are many, it is multifactorial. So it is, to generalize it, yes, we can say that the inherited disorders, if the patient is homozygous for any mutation, they will present to you early in life, whereas like as early as 1 year of age or 6 months of age. But if they are carriers, they might never, it is just an incidental finding. And if there is a somatic mutation or any other mutation, they may come later on in life. And certain genetic disorders are incompatible with life, so the child will never be born.
Ma'am, like for the general people, what exactly is homozygous? What exactly is carrier? What do they mean in general terms?
See, in general terms, if we talk about, we all get one, all have pairs, chromosomes in pairs. So one pair, one of the chromosome is from the mother and the other chromosome is from the father. So if both the mother and father have one defective gene, and from the mother also the child gets the defective gene, from the father also the child gets the defective gene, so the child becomes homozygous. But if the child gets one normal gene from the mother, one defective gene from the father, then the child is a carrier. So both the parents are in this case both the parents are carriers. If only one of the parent is a carrier, that is, only one of the parent has one of the defective genes, then the chances that the child can only be a carrier, the child becoming a homozygous, are not there. That is why we usually, for, if I talk in terms of hemoglobinopathies, when we screen the mother, and if the mother is carrier, then the next thing is to go and screen the father. If the father is normal, then we do not usually go for a prenatal testing. But in case the father is a carrier too, then those cases, it is mandatory that we go in for a prenatal diagnosis.
Ma'am, what are the most common myths and misconceptions that you have usually encountered, like either from the medical professionals or from the patients?
Okay, I can share some personal experiences where I have got reports from my own people, like from my own family or friends who have gone through genetic testing. So, a major part, not exactly a myth, but I'll say more of challenges. Unlike a blood report or any other report, they're not able to understand the report. So, as a healthcare professional, uh, to explain the report whenever the patients are getting the report, where even for an anomaly scan, sometimes if they just say it is normal or there is something abnormal and we need to go on doing this. So these are some personal examples which I'm quoting from my own personal life, where I have to explain it to my friends and family what this test means, how important it is to get further testing done. So somehow there is some communication gap. So that is a challenge, I think, because as medical professionals or as lab people, we are very busy in our work. So definitely there should be people who would explain that report in entirety to the patient, to their satisfaction, where they're given enough time and enough, I would say, enough time, enough explanation, which satisfies their queries and which satisfies their questions. So I would urge all of us, like all the healthcare professionals, to spend time, a lot of time with them, till the time their queries are not answered, to explain. Just telling them that one test came abnormal, so they have to go for another testing, And because that is abnormal, they have to go for a third testing, can be sometimes a little taxing. So yes, but I know that everybody would be following to it to their best, but sometimes we are not able to satisfy the patients. So that is something where we are still, I would say, even if I talk, yes, we are still a bit challenged to satisfy the patient, because these are some diseases which are not like our usual diseases. So it is difficult for even us to tell the patient and for the patient to understand. So here it needs more understanding. So we need to spend more time with each patient, unlike for other diseases.
I mean, also, I think given the fact that there is no definitive treatment for it, like you just can't say that you just take this tablet and it'll be gone.
God, yes. So there is there, and majorly because it is something to do, if we talk about prenatal screening or if we talk about newborn screening and the genetic tests associated with those, and especially when they already have one child suffering from it. So in that case, it becomes very difficult because the patients are very apprehensive. If you talk about the myths associated with it, so certain things come with a taboo. Still, there is a stigma. Still, there is a thing that okay, there is something wrong with the lineage. So there are questions raised. So the social stigma attached to it is a taboo. And then the myth is that if somebody is being sent for genetic testing, that means it will come positive. So that fear, it is not exactly a myth, but a fear amongst the parents or the person who's been advised genetic tests. And because only some specialized centers are doing it. So again, the myth is that why I'm being sent only there, why I cannot. And then there is certain cost attached to these tests, which is at present, for some people, it is not very affordable. So for some, yes, it is, but for a majority, it is not that affordable. So that is again a challenge, that not everybody would be able to afford such a treatment. So not exactly myths, but yes, you can say that these are the limitations which we all go through.
And like you said, that a carrier needs to also be tested before. Yeah. So it is also, I think, difficult to convince them. They'll be like, we are okay. We are okay. We are fine physically and mentally. So why do we need a testing?
I have done that in my own close circle, where I have told people that you should go get tested after looking at their reports, but they do not, because they do. There is a fear that what if it comes positive, and just out of that fear, they just ignorance, as we say, is bliss. So people, till the time they have some problem, they do not want to get themselves tested.
Because that fear would kill them more than.
Yeah. Or you can say that it's like, why should I? I'm perfectly normal. Why should I? So I think the only way forward is to educate people more and more about these tests and about these disorders, so that they become more receptive.
About how it can affect their future generations if not caught on earlier.
Yes. Yes. And a major limitation is because people who are not married. So we now advise, especially for hemoglobinopathies, premarital screening. So a major limitation to that premarital screening is that they think that they would not be able to find a good match. So these are certain social limitations which we face, and that is which these are some things which actually prevent people to go on with these tests or these screenings. Go ahead with them.
Ma'am, anything you would suggest the audience that they should inculcate in themselves so they can prevent such taboos or such limitations? Any suggestions for the audience?
We should just be inclusive, more acceptable. If we are okay with accepting a person with a genetic disorder, or a person who's a carrier for a genetic disorder, and if we do not make that an issue, so yes, that would be helpful. That would make it more acceptable. So inclusivity, as we say, in every field. So that, and more of acceptability, more tolerance. Yes, more less of judgment. These will definitely help people go in for such screenings more, and less of social stigma attached to it, less of social taboo attached to it. Yeah. But that will definitely come from more teaching, educating people more and more, making people aware of all these things.
So, do you think they should be included in the routine screening that happens, like how vaccination has a schedule?
We are doing them in routine screening because, see, somebody who's affected, they need an early diagnosis and appropriate management for that disorder. So it is being done routinely for certain disorders. Yes.
And also, who all can have a future in genetics? Like, what are all the various fields involved so that you can join, like, apart from MBBS or BDS or nursing and other?
See, now we have scientists in a big way, people who have pursued their PhDs after doing BSc, MSc. So they are working big time in the field of genetics because they're coming with translational research. Another very important aspect of genetic testing or the world of genetics is genetic counselors who may not be doctors, like who may not be MBBS or MDs. So that is another thing which is beyond the healthcare. So they can also come into picture and they play a very big role because they're the ones who actually talk about the reports with the patients, who make the patients understand the reports, who are in the forefront and who advise how, and they stay with the patients. So even doctors can become genetic counselors, and geneticists themselves can go in for genetic counseling, but there can be people from a non-medical background, that is, who have not done MBBS or MD, who can do a course in genetic counseling and be genetic counselors.
So they can explain the patients better because usually doctors have a time constraint.
Yes, yes.
That brings us to the end of this podcast. Thank you so much, ma'am, for having such an insightful conversation with us and sharing your perspective today. It's been truly an eye-opening to understand how this field is shaping the future of the way we perceive the diseases, our personalized medicine, our treatment options. I hope this discussion will be of great help for people in understanding what genetic testing is in very simple terms. Thank you so
I
much.
hope so too. And thank you so much for having me here.
Thank you.
Thank you.